I volunteered for the Marine Corps in 1965. So I decided I wanted to see if I could become what a Marine becomes. Immediately went to Vietnam, spent 13 months there, and got out of the Marine Corps in January of 1968. Once I retired at age 65 and went to Medicare, I no longer had dental insurance. As a young child, before my memory, I was hospitalized twice with double pneumonia, as I was told, with extremely high temperature. Those high temperatures for young infants does do a significant amount of damage to dental. So I have been with dentists forever. So insurance not being available had me procrastinate dealing with what I should have dealt with a few years earlier. Most of the back teeth had been pulled because they were not salvageable. I probably had more root canals and crowns in my mouth than I had healthy, normal teeth. So I had to do something with that because I'm very involved with Honor Flight, which is the organization that takes predominantly World War II, Korea, and Vietnam veterans to Washington, D.C. free of charge for them to see their memorials, which is particularly important for the World War II veterans, as that was the last memorial that was done. So we will have on a welcome home, 200, 300, 500 people will welcome this flight back. And, as someone who's kind of in charge of a certain area of that, probably doesn't look real good having that kind of a dental issue that's out there that made me quite self-conscious. A lady that is in the group with me here had been seeing Dr. Runion, so arranged for me to go out and have an interview with him and go over it. And the initial conversation we had is learning about me, an interest in what I had done, interested in my military career, which then led us into, let's talk about what we can do, what we should do, what you need to make a decision about. I knew what was going to happen, that they were going to continue to deteriorate. I would continue to lose teeth. I would continue to get a darkened front tooth. So we made the determination to go ahead with the whole thing. So I have full upper and lower arches, full set of teeth, run from the front to the back, just more than what I had when I went in. So there was never a period of time where I was toothless, which is obviously important. And the thing I like about Dr. Runion is he's totally dedicated to making me better and other patients better, and satisfying their needs and satisfying his desire to have everything be the way it should be, not accepting anything less than perfection.